Hi, my name is Richard Train.
And I'm Hogan Allen, and we're the co-founders of Get Results Marketing and Business Coaching. Outside today.
Outside today. Why are we outside?
We're at a golf course.
It's a beautiful day here in Maryland.
Absolutely. Look around, you can see. I mean, you got beautiful trees behind us. That's where Richard will be at most of the day, trying to find his ball.
Pretty much all day.
So, and why are we here? Why are we here? Well, besides the fact that we love golf.
Well, first of all, last night on our show, The Whole Tooth, on Blog Talk Radio, we had a fantastic interview.
Rhonda Mullins.
Right. And it was all about transition success.
Yep. Her topic actually last night was vital pitfalls to avoid for transition success in dentistry.
Right.
So, like always, let's do our recap. Let's crank out our top 5.
Well, we want to make sure that you understand that it's much better to be digging your way out of a sand trap than it is to be digging your way out from underneath a practice that is not as successful as you want when you're trying to transition out of it.
That's a really good analogy. I like that.
I'm a poetic guy.
You are. Can we get on with this so people
Let's
get back to work?
Yeah,
okay, excellent. Number one reason why most transitions kind of fall apart.
Yes.
Has to do with the lack of clarity between the two parties that are involved.
Exactly.
One of the main reasons she brought up was just the cost. What's the cost of this transition going to be?
Well, you have to put everything in writing. You have to spell out some of the most important things, such as what is the cost?
What's your role going to be?
Absolutely.
Between the associate or doctor, or if it's 3 doctors, however it's set up.
Needs to be fully spelled out.
Absolutely.
Second point, if a transition is in the works, you should have an annual employment agreement between both parties, the doctor and the associate.
If the transition could be a 5 to 10 year transition plan.
Or even a 1 to 2 year, it doesn't matter.
Exactly.
Regardless, you need to be able to revisit it periodically to make sure that you're getting it right.
I agree. Third point, for a smooth transition process, a few things are definitely needed.
Yes.
There's no gray area about it. You must have a clear cost of the sale. You got to know what it's going to cost.
Yep.
Bottom line, no gray area.
Yep.
And an unquestioned clarity on the partnership agreement.
Absolutely.
Let's roll.
Okay, next point. Even today, now this was an astounding number to me, easily 20% of transition agreements need to be examined because they're just having some trouble with some of the details, or it just doesn't seem to be working out the way that they had originally planned.
And I'm amazed by that because of the amount of consultants that are out there and transition companies that are out there nowadays.
Yep.
So, that's still a ridiculously high number.
Exactly.
So, last big point. If you're going to do this, you have to be able to justify the numbers.
Right.
That's really the big thing. So Rhonda said, add anywhere between 55 to 65 new patients every month.
Right.
Just before you even get to the point where you're going to attempt to do this.
Well, and that's your new patient count.
Absolutely.
That's what you need to be doing for new patients alone. That doesn't even touch the fact that you need to have a solid existing patient base, and you need to know how to calculate that.
Yep, I agree. So, in closing, like always, we're getting ready to go play some golf, have a little fun today. Sorry. Make sure you join us next Tuesday, the 28th, at 8:30 with Laura Galloway.
Yes.
This is going to be a good one. Everybody needs to tune into this one.
Right. It's called Creating Harmony Between Your Personal and Your Professional Life.
Absolutely. So, like always, if you have any questions, feel free to give us a call at 800-275-2350. And yes, if you call, we actually roll the phones to our cell phones, so we'll actually answer it even if we're here.
Even on the golf course.
Even on the golf course.
Let's also not forget to remind everybody that we have a fantastic addition to our website, which is the entire interview, all the main points that we covered with Rhonda last night.
Yep, all 10 actually. It's 5 extra.
It's 5 extra, and it's in much greater depth as well.
I agree. So if you have any questions, like I said, give us a call, or you can check us out online at getresultsfordentists.com. Thanks, and have a great day.
Have a great day. You ready to go hit the
I'm going to go find Richard's ball. We'll be back later.
Bye-bye.